Hi guys! Welcome to my blog, Dr. Neckneck Explain. Today, we are still here in Bali, Indonesia. I just wanted to show you that mountain. That mountain is called Mount Agong. It's actually a volcano. It is the largest, tallest volcano here in Bali, Indonesia. Today, we will discuss about high cholesterol o kaya mataas ang cholesterol or hyperlipidemia ang tawag natin. First of all, siguro pag nagpapa-check up kayo sa inyong doktor, mayroong kayong lipid profile or lipid panel na pinapa-test sa inyo ng inyong doktor. Marami akong kamag-anak na nagtatanong, pakibasa nga po itong resulta, Dr. Neckneck, pakibasa nga itong resulta. So, for this time, it's good time para i-discuss kung ano ang mataas ang cholesterol or hyperlipidemia or high blood cholesterol. First of all, ano ba ang lipid? Yeah, kasi pag nagpapa-check up kayo, di ba? Lipid panel, lipid profile. So, ang lipid is actually a fatty substance sa inyong katawan. It actually has a good purpose para sa ating katawan. There are four major types of lipids in our body. Number one is the fatty acids, phospholipids, triglycerides, and cholesterol. Actually, ang major medical concerns ng mga doktor are these two types of cholesterol, namely the triglycerides and the cholesterol. Pero kung for this time, we will just concentrate on cholesterol kasi medyo mahaba. Okay? Actually, itong dalawang lipids na to, they are the major risk factor sa pagkakaroon ng stroke, ng heart attack sa mga pasyente o kaya coronary heart disease sa mga pasyente. For cholesterol is produced in our liver. Actually, 80% of the cholesterol in your body is produced in your liver. And the rest of the 20% is taken from the food that you eat. Example of these foods are mostly from the animal sources like poultry products, yung mga chicken skin ninyo, yung mga sisig ninyo, pork belly, mga dinuguan, mga sisig, and seafoods like squid, crabs, milk dairy products like your butter, your cheese. Egg yolks is also a good source of cholesterol. Cholesterol is actually, if in normal level, there is a good purpose in our body. Like, they are needed para sa production ng vitamin D sa ating katawan, production ng bile acids, para mas ma-absorb yung mga nutrients sa mga kinakain natin. They are also part of the cell membrane of each cell of your body. So, cholesterol is an important lipids in our body. Pero, paano kung nasosobrahan na ang cholesterol sa katawan mo, mataas ang blood cholesterol sa iyong katawan, sa iyong dugo? Ang nagiging problema dito, pag mataas ang iyong cholesterol, nagkakaroon ka ng atherosclerotic plaque. Ano ang atherosclerotic plaque? Atherosclerotic plaque is a fatty depositions sa inyong blood vessels. Pag tumatagal, nag-o-obstruct itong atherosclerotic plaque na ito sa inyong mga arteries. Kung ang artery na naapektuhan is yung sa inyong puso or yung tinatawag nating coronary artery, pwede kang magkaroon ng coronary heart disease. At pag naging severe ang obstruction ng blood flow towards to your heart, pwede kang ma-heart attack. At pag ang artery na naapektuhan is actually artery from your brain, pwede kang magkaroon ng stroke. Mas tumitindi at mas tumataas ang risk mo na tumaas ang iyong cholesterol at magkaroon ng atherosclerotic plaque pag mayroon ka pang hypertension, pag obese ka, pag mayroon ka ng diabetes, pag mayroon kang family history ng pagkakaroon ng hypercholesterolemia or hyperlipidemia sa inyong angkan. Ang smoking is also a high risk factor para tumaas ang iyong cholesterol at magkaroon ng atherosclerotic plaque. At mind you, most of the time, ang pagkakaroon ng normal level ng cholesterol sa inyong dugo, ang doktor ay pwede pa rin magbigay o i-continue niya ang inyong mga gamot para sa inyong cholesterol kung ikaw ay meron ng mga ganitong sakit, diabetes, kung na-stroke ka na dati or nagkaroon ka na ng heart attack dati. No matter what is the result of your cholesterol in your blood, usually your doctor will still continue your medicine for your cholesterol. Ngayon, pag napapansin nyo sa blood lipid profile or yung test na pinapakagawa ng inyong doktor, nandun yung two major lipids na concern ang doktor, yung triglycerides mo at saka yung cholesterol mo. There are two main types of cholesterol. Nakadepende ito sa lipoprotein transporter na nakakombine sa cholesterol mo. Remember that cholesterol is actually water non-soluble. Ibig sabihin, hindi ito natutunaw sa ordinary room temperature. They need lipoprotein in order for them to be transported throughout the body. Okay. So, number one type of cholesterol is the low-density lipoprotein cholesterol or yung tinatawag nating LDL. LDL is a cholesterol that will distribute from liver to other parts of the body, and they have the tendency na mag-build up ng atherosclerotic plaque. That is why they are called the bad cholesterol. On the other hand, the second type of cholesterol is the high density lipoprotein cholesterol or yung HDL cholesterol. These cholesterol are the cholesterol na anything excess sa body mo na cholesterol will be transported to the liver. So, yun ang tinatawag nating HDL cholesterol. And they are called, ito yung tinatawag nating good cholesterol. So, kung mataas ang good cholesterol mo, it's better. So, hindi lahat ng cholesterol are negative. And mind you, they serve a good purpose in our body. Like sinabi ko nga sa inyo, yung vitamin D production, part of your cell membrane. So, cholesterol is actually needed in the body. Kaya lang, kung sumosobra, like lalo na kung sumosobra ang bad cholesterol, your LDL cholesterol, doon nagkakaroon ng problema. Although sometimes, bakit nagtatanong yung ibang tao, bakit ako, mataba ako, siya payat? Pero yung payat, mas mataas ang cholesterol level niya compare sa akin na mataba, pero mas normal yung blood cholesterol ko. Actually, maraming factors kung bakit nangyayari yon. Number one is actually some diseases. Like, kung may diabetes ka, mas mataas ang chance mong tumaas din ang iyong cholesterol. Pag may hypothyroidism ka, pwedeng mas mataas din ang chance mong tumaas ang iyong cholesterol. Kung mayroon kang hereditary problem sa family ninyo, pwede rin itong namamana. Kaya, yung ibang tao, mas mataas ang cholesterol nila despite na mas payat ang itsura nila kaysa sa mga matatabang itsura. And of course, as one of the major source of cholesterol in our body is actually by the food that you take. So importante na we should be mindful of the food na kinakain natin. As what I have said, ang karamihan ng source ng cholesterol sa food na kinakain natin ay actually sa mga animal sources. Ang recommended na pagkain ng egg yolks sa taong may normal na cholesterol is actually 3 to 5 egg yolks in 1 week. Pero pag mayroon ka ng matasang cholesterol, it is recommended na makakain ka ng egg yolks less than 3 egg yolks in 1 week. Remember, I'm talking about the egg yolk. Kung kaya mong egg without the egg yolk, if you can eat more, it's walang problema doon because that egg white contains more of protein. Second factor kung bakit tumataas ang cholesterol mo pagdating sa pagkain ay through the type and the amount of fats that you are eating. Remember, polyunsaturated fatty acid and monounsaturated fatty acids will help to reduce your cholesterol kung ito ang gagamitin mo instead of products that are rich in trans fatty acids and saturated fatty acids. Ito, nakikita nyo lagi ito sa mga oil products na ginagamit niyo. So, if you wanted to improve your cholesterol, piliin niyo ang mga products na mayroong polyunsaturated fatty acids and monounsaturated fatty acid instead of mayroong trans fatty acids or saturated fatty acids. Dahil dito, it will help you na mapababa ang cholesterol ninyo. Pero, of course, always remember that all cholesterol, all fats, all oils are high in calories. Pwede pa rin kayong tumaba. Okay, so the best thing is still, when cooking, do boiling, grilling, steaming are still the best to reduce your cholesterol in the body. Pero kung kailangan nyo talaga mag-fry, better to use na lang yung mga mayroong polyunsaturated fatty acids and monounsaturated fatty acids. Example nito are yung mga olive oil, soya bean oil, corn oil, sunflower oil. And improve ang cholesterol level ng katawan ninyo. You should eat food with high fibers because it will trap the cholesterol in the food that you eat and it will not be absorbed in your body. Like yung mga pagkain ng fruits, vegetables, this food will really help to reduce your cholesterol. That's for now. Hope you understand what is hypercholesterolemia. So, hypercholesterolemia or high blood cholesterol is already marked as Dr. Neckneck explained. Thank you very much.